Welcome to Season 2, Episode 2 of Collaborative Conversations. I am, as always, Dave Plow, and I'm joined by
Barbara Maxwell.
And today we we change up our host, we change up our guests, and today we're going to have Alex Buchanan of IUIPE. He's going to be interviewing Samantha Mitchell of the Crawfordsville Mobile Integrated Health Department. And why do we have Alex talking to Sam, Barbara?
So this is part of our series where we're talking with people who do real live collaboration every day and collaborations that really impact the lives of people and populations. And so Samantha's work as in Crawfordsville on the Mobile Integrated Health Department really focuses on improving the lives, particularly of like maternal health and infant health through amazing interagency collaborations that are designed to kind of break down the silos that often make care and population health, particularly in rural communities, break down. And so her work is really beautifully focused on that sustainable community engagement and breaking those silos to really make sure that, particularly in rural communities like Crawfordsville, you get really good outcomes for people.
Yeah, and we chose Alex specifically for this episode because of his work in what we call our collaborative topics series. Since we're focusing on the work in the communities and the people who are out there doing it this season, Alex's work really focuses on those people from everything from our cycles of addiction, which we mentioned in our first episode and that our first guest, Carrie Hagan, was a part of, to our veteran trauma and transparency program. Alex is in there and he's really focused on getting in with the people that are doing and that will be doing the work. That's kind of his whole MO with the collaborative topics series.
Yeah, he's a master of building the exact collaborations that him and Samantha are going to talk about. And so you need to have that willful intention when you're in particularly rural communities, a willful intention to build those connections and to really build strong interagency partnerships.
Yes, it will. So with that, we're going to go ahead and let Alex take it away.
Samantha, thank you so much for joining us this afternoon. Really excited to talk to you and learn more about your program. So the main objective behind this series is to learn about some of the exciting and interesting interprofessional programs that are going on throughout the state of Indiana. And, my colleagues and I have a general idea of some of the work that you do, but could you, one, tell us about some of your work you do and how it's interprofessional with different professions working together?
Sure. Just to give a brief introduction again, I'm Samantha Mitchell, and I serve as the director of the Crawfordsville Mobile Integrated Health Department. And in this role, I lead efforts to connect healthcare and community services, really ensuring that individuals receive the care that they need directly where they are. Our team focuses on bridging gaps between EMS, so emergency medical services, hospitals, primary care providers, and the social services to provide a more holistic approach to healthcare. Through these programs, which are very innovative, we work to improve health outcomes, reduce unnecessary emergency room visits and hospital admissions, and then strengthen community connectedness. So the overall goal is really to make healthcare and social services more accessible for everyone, and particularly those who face barriers in the traditional healthcare setting.
That's awesome. And congratulations on all of your hard work and just kind of going through that process and talking about holistic healthcare and kind of filling in those gaps. I think what we try to educate and learn about here at IUIPE. So I'm curious, with the work that you do and the professions that are involved, can you talk about some of the professions that are typically involved in the programs that you do and some of the challenges that they face on the day-to-day experiences?
Sure. So one example, and for a lot of mobile integrated health community paramedicine programs, is working alongside the emergency medical services and identifying frequent 911 callers who might need more comprehensive care. But rather than just responding to these calls, we have a comprehensive team. In our office specifically, we have retired firefighter paramedics. We have social workers in our office. We have registered nurses, previous health educators. We have public health experts. that all follow up with these individuals to assess their needs, connect them with, again, primary care and any other social services, such as it could be food assistance, mental health support. We work with mother and baby, transportation services, really a mix of whatever an individual might need.
Yeah, that's really exciting. And you mentioned mother and baby, and that caught my attention right away. Could you talk a little bit about what mother and baby entails?
Sure. So in our programs or in our department, we have 3 programs that we focus on, chronic disease management being one. But another one that is very popular is Project Swaddle, and that is working with high risk moms and babies. So we actually started this program because in our community, our hospital does not deliver babies. So majority of our residents need to go outside of the county, and that takes anywhere from 45 to 50 minutes to get to a hospital. So we saw that as a need to bring that service, to utilize these medics, nurses, and social workers to wrap around these moms who might be first-time mothers. They might have a medical issue such as gestational diabetes, previous miscarriages, loss, that they could use that, again, medical expertise and have more of that one-on-one connection than they do at the doctor's office to make sure that they are going to have a healthy child. And mom stays healthy too. So we've recently added to this program, and we work with mom and baby up to age 3 at this point.
That sounds like exciting work and really necessary work, and given the communication channels that are needed, once again overlaps with a lot of what we try to teach and instruct from an IUIP perspective. So I'm curious, with some of the mobile integrated unit work that you've talked about, can you talk about what you enjoy most about your role, or maybe even an example of a really fulfilling moment or fulfilling story that really captured why you do the work that you do?
Sure. To answer the first part, one of my favorite things is the dedicated and passionate team members that I work with. This is not a job for just anybody. You definitely have to have that compassion, and we do home visiting. So really our big piece is meeting people where they are. And that can be very complex for some individuals, again, when we're looking at addressing those social needs. So if they don't have transportation to an appointment, they don't have a vehicle, some of these people don't have health insurance. We help navigate all of that and put these pieces in place so that they can reach their highest potential of health possible. So that part is the most fulfilling for me, and in watching all these different experts in the room get together. And while that can be challenging, right? We've had different backgrounds in education, we have different scopes, but they really all need to puzzle piece together to be able to work seamlessly. And really the end goal is to help the patient. And we all have that drive in mind. We just might get to it in different ways.
Yeah, absolutely. I think having the objectives or having the clear-cut goals and getting to that endpoint always looks different. It's not always linear, but it's really exciting work. And so when we were talking off camera a little bit, you mentioned some of the collaboration you've done with Wabash College. Would you be able to talk about that a little bit? That sounded really interesting and
Yeah,
exciting.
so I come from public health. That's my background. And we always had interns. I was a public health intern at one point. So I know the value in working with students and working with, again, colleges, because we are a staff of 7 and we can only do so much. Even though we have the different expertise in the room, we rely on community partners and academia as much as we can. So, for example, we have undergrad interns in our office. We also have had master's graduate students in our office working on things such as data collection. It can be something as simple as creating our flyers that are public facing for us. Again, we're stretched thin
Yeah.
for what we're doing. It is new and we've made it work. We've been mainly grant funded in the past. So we have to use, and we're government. So, we have to work with what we have. And again, getting these different ideas and experts is so beneficial for us. I want to make sure when we have an intern coming in that they're not just shredding papers or doing a project that doesn't mean something to them. So we try to find something that they're interested in. If it's mental health, we'll pair them with our quick response team. If it's mother baby, they'll go with Project Swaddle. And again, try to find something tangible that that's good for us, that works out for us. And that's also been creating a toolkit of our programs, writing policies and procedures. I mean, it really is a mix of things, but having that connection with these schools has been so beneficial, not just for our department, but what we're doing for our population. So
Yeah,
we're grateful for that.
that's really exciting. And the more I talk and interact with you, the more it sounds like you have your hands in in a lot of different projects and a lot of different entities within Crawfordsville in Montgomery County. I'm curious, both with your role and from a mobile integrated health perspective, what do you think's the biggest challenge that you run into day in, day out with your role and the work that you do?
One of the biggest challenges is the actual lack of resources. So Crawfordsville, Montgomery County is a rural community. A lot of the resources are in Indianapolis, Lafayette, 50, 60 minutes away from us. So we have to get creative. And while I believe that our community is rich in services, meaning we have the people that want to serve, it just makes it challenging to find with gaps in funding, staffing, access to those critical programs and services such as behavioral health inpatient. We do not have that, or affordable housing, which is a problem really everywhere right now. But with that being said, rural community definitely has its advantages. So having those strong relationships, working with other organizations such as we work with police, we work with fire, we work alongside probation, the court systems, we work alongside the hospital that is here, the public health department, really just about everybody that's a local stakeholder. We do have this close-knit network that allows us to work cohesively and avoid duplication of services. So again, with not having a ton of resources, we don't want to have 3 different things that are all working towards one common goal. We want to just help and enhance those services and
Yeah,
programs.
absolutely. And it sounds like although your community is stretched pretty thin, the one advantage to that is it's pretty easy to identify key stakeholders within the community in order to get tasks or get objectives accomplished. Would you say that's accurate or fair?
Absolutely. Yeah. We've been
Nice.
very fortunate.
Nice. So obviously you've accomplished a lot with the work that you've done and talking about some of the organizations and entities that you're a part of. Are there any long-term goals that you'd like to talk about or that you envision as far as your program goes? And it can be any of the programs that you're involved with.
Sustainability. That's always the big one, right? As I stated initially, when we started these programs, we do have a partnership with our local hospital, and that has been amazing. But we've grown. The need continues to grow in the community, and I think we're not unique in that. We speak with multiple other counties that have mobile integrated health departments or are trying to start them under their fire department, EMS, hospitals. But we're all going after the same grant dollars. And right now, grant dollars, they're dwindling. So, and we've been using them for quite some time. So, very fortunate that we were able to show through data collection that we have value in what we're doing. So, our mayor did make us our own city department in 2024. So, he and the city council see value in this, but we still need to make sure that we have a model in place that it's going to continue to be sustainable. And that's just what's worked for us. That doesn't, other communities are still trying to find that sustainability piece. So policy, legislation, advocacy that at some point we could get a reimbursement model for the services that we're providing through insurance companies or Medicaid, Medicare would be wonderful. So those are long-term goals that we've been trying to address. Some of the other long-term goals that look at health outcomes, we're, of course, wanting to move that needle. We're wanting to be more preventative rather than reactive. So, looking at rates, for example, in our community's tobacco cessation with pregnant moms, that continues to be an issue. So, we want to find programming that can address that specific need. Housing, as I mentioned, transportation barriers. So, these are just some things that are unique to our community. But having, again, these collaborations and all these different people working together, that we have to have that in order to do it. We can't do it ourselves as a group of 7.
Yeah, yeah, absolutely. And it sounds like you and your colleagues have had tremendous success in breaking silos within organizations and professions to give patients and clients the care that they need. If you were approached by a county or community leader that really struggled with breaking silos, whether it be from public safety and healthcare or the criminal justice side with fire department, whatever it was, if someone asked for your advice on breaking silos to build better collaboration, what advice would you give them?
One thing that I typically mention is looking at your community health needs assessments. So, most health departments or hospitals, and even if it's not them, going to your state health departments and really figuring out, because most of them are doing some sort of assessment that is already looking at this. So, you don't need to reinvent the wheel there. Um, but start showing up to some of the community initiatives that are going on in your community. Get familiar and network. Sometimes I feel like in these settings, you feel like you're showing up to a meeting and you're meeting just to meet, but the networking that happens within those meetings has, I think, what has really helped us in Montgomery County. Um, we have 2 pretty robust coalitions in this community. And again, the assessment, the need, they find the top priority areas, and that's where you can pull on your partners and start to see action and get a group together. And sometimes those just happen organically. But again, it's because you know this partner and you know the services that they provide, and you call them up and say, hey, I have this initiative or this idea, and it grows from there. But what I like about the community needs assessment is that that work has already been done. So we don't necessarily need to go find the need or just arbitrarily pick something. We've already asked the community and the hospital and all these stakeholders, what are the issues that you see and what can we do about it? So that's always my go-to, and finding the public health department, I think, is a wonderful place to always go. And again, finding through academia if you have that in your community. And if not, these other stakeholders probably have a contact of some sort that can help pull in these partners.
Yeah, yeah, I think that's a great answer. And I think what I've learned over my last handful of years working at IPE and School of Public Health, there are a lot of talented people that work at local health departments and are very knowledgeable and have a really good pulse on their community. So I think that's a great way to get started. I'm really glad you touched on that. If if someone got online or watched this interview and saw the amazing work that you're doing and wanted to be a part of it and wanted to get involved in some capacity, what advice would you give them on initial first steps to approach someone or some organization?
Sure. So I think there are many ways to get involved with MIH. Again, I think it depends on the individual's background and interest. If someone is going into healthcare, whether it's paramedic, nurse, social worker, physician, I would just encourage them to explore maybe their local MIH programs to see if they have them. Many organizations do offer training in chronic disease management, maternal infant health, again, those social determinants pieces. But if they're not in healthcare, I think there's still ways that we can support those efforts. So, volunteering with local organizations, as I had mentioned, that maybe are addressing food insecurity, the housing, mental health, substance use, whatever is helping to strengthen those community resources that our programs typically are relying on. But the advocacy piece is also key. So being able to just raise awareness about the importance of these programs and just supporting policies and that fund certain initiatives that I just mentioned could have a large impact. So MIH is all about meeting people where they are and providing care that goes beyond the traditional doctor's office or medical setting. So anybody who is passionate about improving their community health and reducing those barriers can play a role and make a difference.
Perfect, perfect. So a question that I like to ask when doing these interviews, and a question we ask at the IPE Center a lot, is why do we think interprofessional collaboration is important? And it's one thing to teach it, it's one thing to tell students, but we love to ask this question to folks who do it in their day-to-day work and need it in order to thrive, like your organizations are doing. So as we're about to wrap up, could you talk about why you think interprofessional collaboration is important?
Well, one, I think it's the heart of what we do at MIH. Again, as I had mentioned, we want to make sure that we are providing comprehensive care and holistic care. So we're checking all the boxes, right? We can't do one without the other. It's a cog in the wheel. So I don't know. I think I've been speaking to why I believe that's important. I don't think one organization can do it all. And the more people we have working together toward a common goal, the bigger the impact.
Excellent, excellent. Is there anything else that you would like to share that maybe I didn't ask or you think would be important for the group to go, or any kind of just final thoughts or words that you'd like to share for IPE?
Don't be afraid to step out of your comfort zone and show up to the meeting that you might think does not bring you any value. That was one of the biggest wake-up calls for me as a student. You know, I was public health, but I was very narrow-minded in what I wanted to do with public health. And the more classes I attended, the more meetings I went to, the more opportunities I saw. And I think that goes for anything. So, you know, you might have a course on, I don't know, something so specific as substance use, but even just going and listening and learning and seeing all these different stakeholders at the table, it might pique an interest that you didn't originally think of. So yeah, just step out, join the meeting, go to in-person things, even if it's uncomfortable, because you just never know.
Yeah, I think that's great. And I think that's a good time to wrap up. Samantha, thank you so much for your time, and we look forward to hearing more about your excellent work.
Awesome. Thank you so much for having me.
So that is it for Alex and Samantha. I want to say thank you to both of them for taking part in this. It's a little bit difficult sometimes to actually get Alex's name and his work out there in a way in which he's actually attached to it, because he really does like to kind of, as a former colleague of mine used to say, put the shine on the people that he works with. So thank you, Alex, for being in the interview. Thank you, Samantha, for being here.
Yeah. And we have more conversations with people who are really making amazing collaborations work in the reality of the real world. And we're really looking forward to the next few episodes coming up. So we will continue to have these conversations with amazing people to showcase their work and put the spotlight on them. So thanks so much for watching this episode. And if you please could remember to come and join the remaining episodes. We really love to have these conversations, but they're intended to really showcase the work of these very active community partners. If you want to follow us as the IPE Center, feel free to email if you like. If you want more information, ipectr@iu.edu. And Dave, would you like to share any of our social media links?
We are most active on LinkedIn, and you can find us there just by searching up the Indiana University Interprofessional Practice and Education Center. Lots of characters, but we will pop up before you get them all typed. So we'll be there. We have updates. We have clips from the podcast. We have interviews with community partners. We have interviews with faculty members, just all kinds of stuff that we share throughout there. And as always, wherever you listen to this podcast or watch this podcast, please feel free to go ahead and, as the kids say, smash that subscribe. We'll be putting out more episodes soon. So thank you so much.